beautiful. There it goes.
Oh, wow.
Wow, that was so loud.
Wow.
All right, so I'm excited to have a new friend here, Joseph. You just found us 2 days ago or so on Instagram, right?
Yeah, a couple days ago on Instagram.
Yeah.
I saw the craniofacial.
All right.
And I was like, I need to do that.
So he's gonna do some craniofacial, but we're also gonna work on your left shoulder today, maybe your right shoulder as well. He works hard, but he's also a Jiu Jitsu player. He grapples a couple of nights a week, and so that has a place in my heart. My brother is a black belt in Jiu Jitsu, and we grew up wrestling, so I was a wrestler all the way through high school. I didn't continue it like he's doing, but you know, it's still in my heart, so I want to take care of this guy and do a great job for him. Do you have any breathing difficulties though? Like sometimes it's hard to breathe out of your nose?
Yeah, most nights when I'm getting ready for bed, I have trouble from either one of the sides is completely clogged up, completely. And then when I wake up in the morning, same situation. It's either one side or the other, completely clogged up. And then when I blow my nose and I blow all the boogers out and all the mucus, it's like it's just it just comes back. It never it's like almost it never stops.
So what this might do is create a little more space in there so that you can get better drainage, and also that it doesn't accumulate as much. So we see that. I do work with a lot of guys that do any type of endurance sport or combat sports where they're frustrated that they're breathing through their mouth when they get winded, because it's more efficient to breathe through your nose as an athlete. So we don't want to see an athlete, if possible.
Yeah.
And I was telling someone about this the other day. Now, you're not doing striking right now in Jiu Jitsu, but we have mixed martial artists that come in from time to time. Now, the mouthpiece sits on the top teeth, just so you know. And if you're breathing with your mouth open and you get punched in the face, you might not knock a tooth out, but you're likely to get knocked out, because one of the things that a mouthpiece does, other than protect your teeth, is protect against concussion, because if you can have your jaw closed, you're less likely to be knocked out. Different combat sport people have been in the office at different times over the last couple of years, curious if they could improve their nose breathing so that they're not inefficiently and sometimes unsafely breathing through the mouth. In your case, it's going to just help your efficiency as an athlete, and I'm always excited about that. So let's get cracking. The sport of Jiu Jitsu, I'm not telling him, I'm sharing this, is a very shoulder intensive sport. It's hips, shoulders, but especially someone as you know, Kimura, there's so many different times that your shoulder could be under strain, or you need your shoulders to do all your work.
Yeah.
And so shoulders are critical for Jiu Jitsu to have a healthy shoulder. So I'm getting a lot of, I'm not getting a smooth lift when we do this laterally. Laterally is to the side. This would be to the front. A little easier that way, isn't it?
Yeah.
But as I come up, you do it yourself now. So turn your thumb this way just a little bit, and then stop when it feels like it's stuck a little bit. It's
right here.
Right about there.
Yeah.
Okay, and you see that angle here. And I agree, that's where I kind of felt it bogged down. So it's floating really nicely. So this would be 0 degrees. This is 90 degrees. 180 is straight up, which it should come to 180. Let's try the right side, although your right side's not perfect, but look how easy it goes from 0 to 90, no problem. Then we break 90 degrees, we still come up, and he gets a little tight right here. So this one's not perfect, but it came up a little higher. Do you guys notice that? And then this one bogged down or hit the brakes a little sooner. So right in there, and I'm holding this down because I don't want you cheating. But in there, somewhere in there, it gets really slow. So I'm going to work on this collarbone first, okay? So I'm going to lift the collarbone. And the shoulder's made up of 3 main bone pieces. We have the collarbone, or the clavicle. Then we have the scapula, which wraps around the front. And then we have the humerus, which is the upper arm bone. Those 3 bones come together and make the bony attachments of the shoulder. Then we got a whole host of muscles and ligaments and tendons, and nerves that run through there, and blood vessels. But we're gonna first work on the bony stuff, because that's what I do most with, is the bony alignment. I do soft tissue also, but we're starting with the bony alignment. So I'm taking the scapula now and dragging it a couple of millimeters from left to right. And then I find, and he's tender up in here, So this is the edge of the acromion bone.
That's where I have a lot of pain too.
And he's got pain right in there. So I'm going to push the head of the humerus down. And I'm also dragging with my arm here. So I'm creating traction. And you can feel that pound in there, right?
Mm-hmm. Mm-hmm.
So the next thing I do is I'm going to release some trigger points behind his shoulder into the armpit. And if I can find any, but usually there's one here. Do you feel that one?
Yeah.
So that's a nasty knot. So I'm in his armpit with my thumb. And that actually is the lat, the latissimus dorsi. And it ties in under the shoulder here. And now I'm deep in there. Do you feel that?
Mm-hmm.
That will hurt because it's really tight on you. Drop that now. Now we have more to do. This is just part one. A little smoother already, isn't it?
Yeah.
There's more. So now you're going to lie, let's see, that's your left side. You're going to lie like this on the table. So we're going to just do more here because what I'm seeing now is I move the collarbone a little bit. I moved his scapula and humerus a little bit. And now I'm still getting a lot of tightness behind here. And this is just horrible, isn't it?
Mm-hmm.
So I'm going to dig these. That sucks, right?
Mm-hmm.
But that's the bad spot, isn't it?
Yep, that's exactly.
Okay. Starting to open up though, you see?
Yeah, I can. Yeah.
So now I have to pull down and create more room here at the AC joint. And pushing down on the head of the humerus, that's the ball on top of the arm bone. And I'm going to check, drop your elbow, bringing the arm out. This way it's still guarded. So he doesn't want to really externally rotate his arm because it hurts and it feels stuck. Do you feel like it's like not a great position?
Yeah, that feels horrible.
But think about Kimuras or bringing your arm in that direction, right?
Absolutely.
So I'm trying to free this up so I can get a more comfortable external rotation and again, I'm pulling this down and creating space because the bone ends right here where my thumb is, and then it dips down into the head of the ball on the top of the humerus, which is the humeral head. You see?
Yeah, that's totally.
We want it to go to 90, yeah. And it should feel looser. Now we have him lie on his back. So someone like him, he probably needs a couple of treatments on the shoulder, but we want to do as much as we can today because he loves doing Jiu Jitsu and he'll keep going as athletes do. So I got to get him better today. Do you know what I mean? Scoot down, or as much improved today so that he feels comfortable going and having a full session when he goes to grapple. Now this is really cool. Big breath in and blow it out. So I adjusted the collarbone and the scapula together. Mm-hmm. Now let's try this. Isn't that nice?
That's a whole different ball game already.
Try it. It's nice, right?
Mm-hmm.
Good. Now there's another piece to that. The nerves that come out of the neck have a lot to do with the shoulder. So scoot forward. So that's under that.
Wow.
Now those nerves go down into the shoulder. Beautiful. Now lie on your back. Those just cracked. I'm going to do lower neck now. Perfect. Nice. Nice. Okay. A little bit more in this area because we didn't hit this yet. Turn your face this way. These are nasty, right?
Mm-hmm.
Now I'm gonna have you lie on your side facing me. Cross your arms like this and bring your hips towards me a little bit.
Oh, wow.
Wow, that was so loud.
Wow. Oh, that felt good though. That felt amazing.
You needed that one, right?
Oh, yeah.
All right, turn this way.
Oh.
Whoa.
Wow.
That was good.
That was really good.
All right, I'm gonna do a Y strap next, and then we're gonna do CFR. Take a breath in and blow it out. What did you feel on that one?
Oof, just a nice pull.
Okay.
Felt good. Felt like a relief, pain relief in my neck and shoulder, like neck and entrance to my shoulders.
This is floppy. This is something everybody squeezes.
Oh, okay.
It's fun.
I saw that
Floppy's
actually.
cool.
Yeah.
And it does two things. One is it's fun, but the other is it gives you something to focus your hands on, so you don't grab my hand while I'm working.
Oh, okay.
Okay. Once I put the balloon in, I'll say take a big breath in and hold, and it looks like this.
Okay.
Try it. That's it. Whenever you're ready, take a big breath in and hold, and did you hear any cracks or separation?
Definitely separation.
Now that's his good side, so that's going to be easier. Point to where you felt the pressure.
I felt it right up here.
Okay.
Right under my eye.
And what's it like breathing now?
It feels much better already from the right side.
Okay. So let's just jump right into the left side next. So this will probably be a little different experience because this is the side that you have a deviated septum.
Mm-hmm.
I can't even get the balloon in that way because it's crushed. You probably broke it at some point. Okay, wait. Now big breath in and do it again. There it goes. You feel the difference? That was much bigger, right?
That was way different. Oof. Oh.
You can sit up now.
That one felt like my whole face just expanded, the whole sinus cavity expanded. And the balloon it even took time for the balloon to get in, but I can actually breathe normal breath. You normally can't breathe out of both sides. Yeah, I usually can't breathe out of both sides. Wow.
Now, what he was saying, it was even hard to place the balloon because that side was very narrowed and blocked. And then I finally got the balloon placed. Then when I squeezed it, I have strong hands. I barely could push that balloon back through there because it was so blocked.
It literally.
And then it finally went boom.
Yeah. You can feel like the spread.
Yeah.
Because it was so closed, it felt like it gave it a little opening.
Did it make any cracking noises?
Yeah, it did a little crack. Yeah.
I thought I heard a.
Yeah. Yep.
All right, let's recheck the left shoulder. You're going to lift it up yourself and see how it's. Is it moving better?
Yeah, for sure.
Okay. Now, like he said, he might need a few treatments, but it's already much better range of motion, right? And are you feeling pain with it as you lift it?
A little bit still. I'd say like 30-40% better.
All right, not bad for a first treatment.
Yeah.
And that's been bugging you for a couple
of
months.
Yeah, it's been bugging me for a couple months. Yeah.
Okay.
At least 2 months. At least.
Actually, what I'm going to do now, if he has time, is I'm going to put some ice on it because we just freshly adjusted it. Do you have like 8 more minutes or 10 more minutes? Right on your skin.
Okay.
And we're going to put it right up in here.
Perfect. Oof.
And you'll just sit and play on your phone for 10 minutes,
All right,
okay?
no problem.
All right, thanks everyone. Cross your arms like this and bring your hips towards me a little bit.
Oh, wow.
Wow, that was so loud.
Wow. Oh, that felt good though.